Hello my dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about ENM 2023 coding changes part 3, that is risk of complication and or morbidity or mortality of patient management. So in first video, I already posted problem part 1 and second video part 2 data. In this video, third element. So there are three elements in MDM: problem, data, risk. So two element I already completed. In this video, I am going to cover third element, that is risk and timing also. So based on element and timing, we need to choose the ENM levels. So third element as well as timing I am going to cover in this video. Those who are not subscribed my channels, please subscribe my channel and press bell button, then select all, then only you will get my future videos as a notifications. Okay. Let's start risk of complication and or morbidity or mortality of patient management. So in last video I already completed two elements. So every element, each element out of these three element, so we have four types. Each element we have four types, that is minimal, low, moderate, high. Okay, so in risk also we are going to see minimal, low, moderate, high. So what will be the minimal? So how will be the documentations? So like that each type we are going to cover in this video. So minimal, low, moderate, high, there are four types in risk element also. Okay, so let's see each type what will be there in our medical report. So okay, so for minimal risk, for example, superficial dressing, nothing will be there for minimal risk, like self-limited or any minor problem. So the doctor will not do any treatment. Okay, so that is minimal. So based on the conditions, doctor will do the treatment. Okay, so based on the condition, doctor only has to decide what will be the treatment. So that treatment only they have to given like four type: minimal, low, moderate, high risk. So if it is problem is very severe problem, then treatment also will be complication also, treatment also extensive only. So like that, based on the patient conditions, doctor will decide the treatment. The treatment related only risk. Okay, risk of complication or morbidity or mortality of patient management. So first is problem, that is condition. Based on the condition, we need to choose one, that is problem. Then data. Data means any lab test or any other services. This related is data. Then risk is all treatment related is risk. So based on our condition, doctor will decide the which treatment we can do for particular condition. So based on this treatment only, they have divided into four types: minimal, low, moderate, high risk. If it is minimal means none. Or example, any rest. If patient will take rest for few hours, then that condition will resolve, like that. If patient is coming regularly dressing, means that superficial dressing and all we will consider in the minimal level only, minimal risk. Okay, so what is the low risk? So low risk examples like over the counter drugs, OCD drugs. So that is patient, doctor will not prescribe this drug, patient itself will buy from the pharmacy and they will take their own risk. So that medication considered as over the counter drug. Okay, so if patient is taking OCD drugs or any physical therapy or any minor surgery with no identified risk factor. What is a no identified risk factor? Usually before doing the surgery, we will sign one paper, right? Consent sign. So whatever will happen, so risk everything, we are the responsibility. Like that, we will give one signing, right? Risk signing, consent signing. That is the with no identified risk factors. If any minor surgery is going to perform doctor to that patient with no identified risk factor, means we can consider low risk. Okay, then IV fluid without additives. IV fluid, okay, what is without additives? But that means what is the additives? That is any vitamin supplement or any drug supplement or anything supplement along with the normal saline, that is with additives. So in this point, IV fluid without additives, that means only normal saline if going, means low risk. Normal saline as well as any drug means moderate. Okay, 4 level. For 3 level, only IV fluid without additives. Okay, then so any of this point, any one point if matching, then we can consider it as low risk. So no need to focus all points should be there in medical record. No need, any of the one point is enough. If it is patient is taking only OCT drugs, then that point we can consider low risk. If nothing will be there, if patient only taking normal saline for 1 hour normal saline, then that will be low risk. Okay, so like this, any of the point is matching in our medical record, then we can consider consider as the particular risk. So within this 4 point, we can consider this low risk. Okay, next is moderate. Moderate, I will give you few examples. Prescription drugs management. What is prescription? Prescription word itself you can come to know. Doctor has to prescribe the medications. That medication, prescribed medication, if patient is taking, then that is considered as moderate. If without prescription, patient itself going to pharmacy and they are taking their own their own tablet, means that is OCT drugs, low risk. If patient is taking any medication prescribed by the physician, means that is prescription drug management, that point will be considered as moderate. Okay, next, decision regarding minor surgery with identified patient or procedure risk factor. Okay, if without identifying the risk factor means low risk, with identified the risk factor means moderate. Okay, any minor surgery. Next, decision regarding elective major surgery without identifying the patient or procedure risk factor. So if minor surgery with risk factor, moderate level. Decision regarding elective major surgery without identify the, that means without any concern, elective major surgery means moderate. What is elective? I already explained you in a basic surgery coding guidelines video. Elective means any planned surgery, any scheduled surgery is elective. Okay, so before surgery day itself, they decided, they scheduled to particular day this surgery will going to perform, that is scheduled means elective. So all elective major surgery without identified patient or procedure risk factor considered as moderate risk. Then last point is diagnosis or treatment significantly limited by social determination of health. What is the social determination? Lack of social determination of health factors. That is patient actually, for example, patient doesn't have any insurance, or patient very low income of job, So patient not able to give that amount to that particular procedure, particular surgery. So due to lack of any financial problem, patient is not doing that surgery, not doing the treatment, means that will be considered as decision to resuscitation, and that is considered as that point. Okay. Social determination of health. So limited by social determination of, so this point also we can consider as moderate risk. Next, drug therapy requiring intensive monitoring for toxicity. So all drug therapy requiring intensive monitoring of toxicity we can consider as high risk. Okay. Moderate risk is completed based on within out of this few points, any one point is matching, then we can consider as moderate. Okay. So next is high risk. In high risk, drug therapy requiring intensive monitoring for toxicity we can consider as high risk. Then decision regarding elective major surgery with identified patient or procedure is risk factors. So without identifying of risk factor is moderate. Same elective major surgery with identified risk factor is high risk. Okay. Then decision regarding emergency major surgery we can consider as high risk. So next, decision regarding hospitalization also high level. If admitted, if without admission, that treatment we cannot do, means that will consider under the high risk section. Okay. Then decision not to resuscitate or to de-escalate care because of poor prognosis also considered as high risk. So if out of this point, if any one point is matching, then we can consider as high risk. Okay. So based on these point only, we need to select either it is minimal, low risk, or moderate or high risk. Based on these points, we need to select one. So each element we need to select any one, either it is minimal, low, or moderate or high risk. This 4 point, minimal, low, moderate, high. So in 3 elements also we have this 4 type. From this 3 element we need to choose any one type based on our documentations, based on that tables. Okay. What I shared you, based on that tables, any point we need to choose from our medical record. So we need to select either it is problem is minimal, or data is moderate, or risk is high risk. So based on our medical report, we need to choose out of this 4 type, we need to select one type. Then with that final type, we have to make a MDM table, final MDM table. Okay. That final MDM table, how we can make, I will share you in the next video. So next I am going to share based on the timing how we can take the levels. Okay. So until now we discussing about based on the elements we are going to select the levels, but as per our 2023 coding changes, based on the element MDM and timing also we can choose the final level of the CPT ENM code. Okay. So let's see the based on timing. So time based coding. So in this time based coding, certain types of ENM codes that does not have any services based on the MDM, so that will be based on only timing. For example, critical care services and all, only based on the timing we have this code sets. Okay. So like that, some services, some places services, we have the only based on the time based codes. So for example, critical care, like that discharge, inpatient discharge, and in nursing facility discharge, in this code set and all, only time based codes we have. Okay. So it is very important to review our our instruction for each category. So each place of service based on the MDM or based on the timing. Okay. Then time is not a descriptive component for the emergency departments. For emergency department, we have the only option based on the MDM level. So no, the time is not the descriptive component for the emergency department level of ENM services, because emergency department services are typically provided on variable intensity basis, so often involving multiple encounters with several patients over the extended period of the time. So that is the reasons the time is not the element of the component of the taking the level of the ENM services. Okay, so ENM service, so codes 99281 to 99285 CPT codes is not based on the timing, so it's only based on MDM level. Okay, so timing, if we are taking high level based on the MDM tables, but low level based on the timing, then we can go for based on the MDM. So whatever level is high based on the which type, either it is based on the timing, our level is going high, or based on the MDM, our level is going high. So based on that, which level is high we are getting, so based on that we can go with. So for example, based on the timing, so if doctor is to spend more time, so the level is going 4 level based on the timing, but based on the MDM table, the level is going only 2 level. So now we can finalize the CPT code based on the timing. So whatever type we are following, so check from by which type the level is going to high. So based on that type we can follow. Okay. So based on the time or MDM, whatever it is, level is high based on which type. So based on that one we can follow that. Next, actually, when time is used for reporting ENM service code, the time defined in the service descriptor is used for selecting appropriate level of services. Okay. So next point is for coding purpose, the time for these services is total time on the particular date of encounter. Okay. It includes both face-to-face service with patient and or family, caregiver, or non-face-to-face with the time spent with patient or with physicians. Okay. So total time spent by physician with the patient or family member or caregiver, the all times we need to calculate for picking the level. Okay. So let's see shared or split visit. So time based, if physician is shared services or split visit service, means how we can calculate the timing. So a shared or split visit is defined as a visit in which physician or other qualified healthcare professional both provide the face-to-face or non-face-to-face work related to the visit. So when time is being used to select the appropriate level of service for which time based reporting of the shared or split visit is allowed. Okay, the time personally spent by physician or other qualified healthcare professional assessing or managing the physician counseling, education, communication result of the patient with the family or caregiver to the particular encounter. So all total time we need to calculate for the time basing ENM level. Okay, next point, if the prolonged time is occurs with the particular encounter, Then we have the separate CPT code for prolonged services. That code only we need to give additionally. So when the prolonged time occurs, the appropriate belonged services code may be reported. The total time on the date of encounter spent caring for patient should be documentation in the medical record when it is used basis of the code selection. Okay, so physician professional time include the following activities. What all the following activities is included when selecting the time? Preparing to see the patient, so that is a reviewing of the all test, that time is included. Then obtaining or reviewing of separately obtained history. Then performing a medically appropriate examination or evaluation is included, it is part of the time in the then counseling and education of the patient family caregiver, ordering of medication test or any procedure, so this ordering time is included. Then referring or communication with the other healthcare professionals when not separately reportable, that time only we can it is included, that time. Then documenting clinical information in the electronic or other health record, then independent interpretation of result, but that interpretation not separately reportable, then only we can consider. Okay, then communication of result to the patient or family caregiver. So care coordination, so the care coordination also not separately reportable, then only we can consider. So these timing all is include with these all activities is included in the timing. Okay, but time some points we cannot consider the timing. So what those points are: the performance of the service that are reported separately, then travel time, then teaching, that is the general or not limited discussion with the recurring for management of his specific patients. So these 3 point we do not count the time spent on the particular encounter. These 3 point we cannot consider the timing. Okay, these are the points time based ENM CPT codes. So based on the timing, so after each CPT ENM, so in the last line in our CPT book, all levels they have given time. So within this from this time to this time means first level, from this time to this time second level. So these things they have given in the CPT book, each level itself. So when I am going to cover the place of service videos, so I will cover the timing, what are the timing, which level. So if it is 40 minutes means which levels is comes under. So these things I will post when I am going to cover the place of service encounter, place of service videos. Okay, so that's all about the timing. So in 2020-23, so based on the MDM 3 element and based on the timing, so these two things only we are going to take the final level of the ENM CPT course. So until the 2022, so we have examination, then history, ROS, physical examination, social history, past medical history, everything we need to check to take the final level. But 2023 history examination everything removed, only MDM part and timing. These two things only we need to look it to decide the final level of the ENM CPT. Okay. So okay guys, in next video I'm going to post the final MDM table, how we can select. Already we understood now the 3 element, how we can take the to select the levels. So each level, each element we completed. So based on this knowledge, we are going to take final MDM table. So this final MDM table I am going to cover post in the next video. So if you have any doubt in this video, please comment, and if you like this video, please like and share to your friends also. Let's see ENM part 4 in next video. Thanks for watching my video. Thank you. Bye bye.